Hullo YouTube. This is Dr. Vibes, a learning point. In this video, we will learn about the difference between metaplasia and neoplasia. Now first, the definition. It always should start with definition, that is what the terms means, especially in pathology. So metaplasia, as you all know, or I'm saying it to you, that it is a cellular adaptation, right? There are 4 types of cellular adaptations: hypertrophy, hyperplasia, anaplasia, and metaplasia. So metaplasia is a cellular adaptation where one kind of differentiated or mature cells will change or will be replaced by another mature cell. And what is neoplasia? Neoplasia is AEU, okay? That is abnormal, excessive, and uncontrolled growth of the cells. And the cells will continue to proliferate even in the absence or the withdrawal of the stimulus. See, even in the withdrawal of the initial stimulus, which is responsible for growth. Okay. Now, type of cellular change, as I've said, this is a reversible change and it is not permanent. But neoplasia is always permanent. That is irreversible. It will lead to permanent damage. Now, what are the affected cells? Metaplasia, I've already mentioned in the first sentence itself, that these are mature cells, the differentiated cells. The mature cells which have complete similarity with the normal tissue cells. But in neoplasia, the dysplastic cells have complete disformity with those cells of origin. What do you mean by dysplastic cells? That means the cells of disoriented arrangement. That means they're not in a proper orientation. Mitotic rate of metaplastic cells will be normal, isn't it? Or there might be mild increase, but here the mitotic rate is very high. Atypical mitosis. Okay, so atypical mitosis is not the usual kind of mitosis. You get to see a tripolar Mercedes-Benz sign here. So obviously that is it will be absent in metaplasia because metaplasia is a normal process. But this is common in neoplasia. Now these are the characteristics of neoplasia: high invasive rate, metastasis, atypical mitosis. The pleomorphism or the difference between daughter cells and parent cell will be too high. So cellular pleomorphism will be unusual because the daughter cells are similar to the parent cell, but in neoplasia this is common. Now invasion and metastasis, it is never present in metaplasia, but this is seen in case of neoplasia. What do you mean by invasion and metastasis? Metastasis means transfer of the tumor from one region to another. And invasion is that a dead cell or a neoplastic cell is invading or destroying the other tissues. So this is not present in metaplasia, but these features are present in neoplasia. Now stimulus, I've already mentioned that metaplasia requires a stimulus for continuation. But here the stimulus is not necessary. Even after the withdrawal of the stimulus, neoplastic cells will continue to proliferate. Now come to examples. Most importantly, it's Barrett's esophagus and Myositis Ossificans. What is Barrett's esophagus? Now you'll see that in the lower part of the esophagus, the squamous epithelium cell is replaced by columnar epithelium cells. This is Barrett's esophagus and this occurs due to GERD, gastric efflux risk. Okay, now come to Myositis Ossificans. As the word says, myo means muscle, ossitis means bone. So bone formation occurs within the muscle tissue. This is mesenchymal to mesenchymal. Like bone is also mesenchymal tissue, muscle is also mesenchymal tissue. Now you come to neoplastic cells example. This can be either benign or malignant. If it is in the epithelial cells, obviously it will be carcinoma, and if this is mesenchymal, this should be sarcoma. So adenoma is benign tumor seen in the epithelial cells. Adenocarcinoma is a malignant tumor seen in the epithelial cells. Now lipoma is a benign tumor seen in mesenchymal cells, and liposarcoma is a malignant tumor seen in mesenchymal cells. Now whenever carcinoma comes, that means it is epithelial in origin, and whenever sarcoma comes, this means it is mesenchymal in origins. And the last sentence is that sometimes metaplasia may lead to neoplastic proliferation. Otherwise, both these processes are very different, as I have discussed.